So I am welcome everyone and so excited to have Dr. Candice Nicole Hargons on as our guest today. She is an amazing woman, amazing psychologist, sexologist. I've got to know her in a number of different spheres, and I know you're going to enjoy our conversation today. So as we continue our series on Black resistance and mental health, we wanted to bring someone on to talk about, Dr. Hargons is a sexologist. We wanted to talk about sexual health, sex positivity, all those things that sometimes in the Black community, sometimes we get very negative and confusing messages or we don't talk about it out. Like there's so much to unpack.
Yeah.
But we're here to talk about why it is important to have positive messages about our bodies and about sex. So let's get into it. Dr. Hargons, welcome.
Thank you for having me.
Of course. And as we get started, I like that my guests really introduce themselves. So tell us who you are, what is a sexologist, and what drives your passion for Black mental health?
Hey, y'all. So my name is Dr. Candice Nicole Hargons, and I am both a psychologist and a sexologist. And so the fun thing about pairing those two is that I get to both study like a researcher, the mental health and sexual health components of life. And as a therapist, I get to practice in those areas when I'm seeing clients. And so it really is about prioritizing for me good sex and all the things that are barriers to that, moving them out of the way or helping us cope better with them, and all of the things that facilitate it, helping us enrich those in our lives.
Excellent. And tell us about Black mental health. So what's your passion? I know a lot of your work centers around Black mental health. So tell us a little bit about that passion as well.
So one of the dope things that I'm doing right now related to Black mental health is called the Neighborhood Healers Project. And so I live in Kentucky. I'm at the University of Kentucky as an associate professor, and we worked with our community. So not just me as a researcher going in and being like, hey, I know what's best for you, but me as a person in the community, as a Black woman in the community saying, what can we do together about our mental health? So this year, we've trained our 40th out of 100 Black community members, people who are not mental health professionals, in mental health first aid, so that they can be the vehicle through which people have access to mental health services. They're the people who refer, they're the people who increase the community mental health literacy and reduce the mental health stigma in the Lexington community. And so it's been an amazing project because it's funded through SAMHSA for 5 years. This is year 2 for us. And the Neighborhood Healers Fellows, that's who we call them. We kick it with them for a full calendar year. So it's not just that we train you and let you be. We check in every 2 weeks. How y'all doing? And how is it going in the community? And then quarterly, we even meet. We break bread together. We have food. I know you and I have talked about the power of food for Black community as a vehicle of our connection and our healing. And we ask them what's been going well in your communications with the neighborhood and what's some of the things that are getting in the way. And we have seen them interface with over 3,000 Black people in the Lexington community. And there are only 40,000 of us in the Lexington Black community. So in one calendar year, our first cohort of fellows were able to do that. And I'm so excited to see what the next cohort can do.
That is wonderful. And I love the model. And definitely we have to talk offline because we're definitely trying to think about what we can do here in Boston. So I love that whole idea of using that. And people have taken it, but I love that there's a research behind it. I know you're going to come up with some dope stats about why this is helpful.
We are.
Excellent. So connected back to your research, actually, I wanted to talk about, I know some of your research areas includes sex positivity and hashtag hot girl science. I love that hashtag. Tell us a little bit about what was going on in the community to lead you to focus on these topics in particular.
Sure. So the most important thing that I start with is that there has been sex research going on in the Black community for decades at this point. But the lens through which that research has been conducted is usually deficit-based. And so deficit-based looks like a medical model where like, y'all got too many STIs, HIV, unplanned pregnancies, what's wrong with Black people? And while those are things that we want to attend to, so that we can facilitate sexual well-being, a part of it is that they weren't telling the full story. They didn't tell what was good sex to Black people, what sexual desire or intimacy or passion looked like for Black people. And that's what sex positivity offers. And that's the lens through which I do it, because I already think the other stuff's been done and been done well. But I want to make sure that we have a comprehensive and more complete picture of what Black sexualities look like.
Now, you've dropped the word good sex a few times,
Yes.
and I would be remiss if I didn't ask you, what is good sex, Dr. Hargons?
I think it's different for everyone, right? And so there are some basic components to it, like it's consensual. It's not even sex if it's not consensual. And then everybody in our sample, so we surveyed like 500 Black people to ask them what good sex is. We were like, what is good sex in 3 words if you had to name it?
Ooh, I love that question.
Look, the number one top word, 30% of our sample said passionate. That was their jam, right? But that wasn't for everybody. For some people, pleasurable, some people orgasmic, some people intimate, some people loving, some people nasty, it just depends. And so you get to really define it for yourself, as long as it has the baseline of consensual and respectful, mutual between partners, if you're talking about partnered sex.
Thank you for clarifying that and explaining that. So definitely something for listeners out there to think about. How would you define good sex in 3 words? I love that question. So tell us, as you think about sex positivity, one of the things that I was reflecting on as I was preparing for our conversation today is just think about the messages I got as a child about sex, right? Growing up, it was like, don't do it. And that was just about it.
Yep.
Don't get pregnant. That's about it. So I'd love to talk about in our communities how we socialize from childhood about, and of course it is not the same for every community, but what are some of the general messages that you've heard around how socialize, particularly in the Black community, how we're socialized to think about sex and our bodies in sexual ways?
Exactly what you just said. Those are the predominant messages, right? So in very rare cases, we have a sex positive family, or you got an auntie who is a hot girl like my aunties were, and they would tell you a little bit more here and there, or you would overhear their conversation while you were getting your hair braided. That was me.
Listening in
like tuning in. They would act like you were not sitting there, but typically the conversation was around, especially for Black girls and women, don't get pregnant. Like avoid boys and sex at all costs until you get your education. Those were the predominant messages, but nobody ever explained why.
Right.
Nobody ever explained how, and nobody ever explained when. So if now is not the time, when is an appropriate time for me to have sex? How do I make that decision critically? And if why would I not have sex, or why would I have sex? What are the reasons that people have sex? And with whom and for what? And all of these beautiful aspects of like a good sexual socialization, many of us missed. And so early on, I was really curious about sexuality. Probably around 8 or 9, I started looking at my grandma's Encyclopedia Britannica, trying to find out when my body would develop and things like this. Like I was curious about it, and I didn't feel like I could ask the people around me. So I went to books to look for it. But books only tell a little bit. They, they tell you about the anatomy, the mechanics sometimes, but not typically. And so I spent most of my career so far thinking about what are the things that we've been missing, so that I can make sure that those are woven into how I talk to youth about sex, how I talk to grown folks about sex. And a lot of adults ask me, well, how am I supposed to talk to my kids about sex if I never had a good sex conversation, if I never had healthy sexual socialization? And so I always offer one resource there on Instagram, Sex Positive Families. They have amazing content, and they're developing a book. I think they have a workbook, but they're developing a book as well. But the way I approach those conversations with kids is developmentally appropriate. So the conversation I have with my toddler at 4 is not going to be the conversation that you have with your child at 10 or 14 or 17. And you want to think about what they really want to know and need to know at that time. So not shutting them down when they ask you a question.
How uncomfortable it is. I'll tell you a little bit more in a minute, but
taking a deep breath and saying, my discomfort around this is normal. It's awkward. And I wasn't trained in this. So it's okay for you to feel that discomfort. But, as Black folk, we feel discomfort in a number of areas, and we go anywhere, we do it anyway, because we're really courageous. And this is one of those areas where we'd have to do that as well.
Yeah, it's so interesting. And thank you for sharing those wonderful tips, because I think we definitely need to have that. I think one of the ways is I make the connection to mental health, right? I think having these overt conversations about sex and our bodies really also is a prevention for sexual abuse and assault, right?
Yes, it is.
And the secrecy and sometimes silence around that. So my daughter, they have a health class. And so the health teacher was coming through the fourth graders. And so there are rumors started. My daughter came with me, she's like you, we got her a body book very early. So we read that together. She reads it a lot on her own. So she has lots of curiosity. And so there was a thing about the teacher had drawn the vagina and the penis was inside the vagina. I'm like, what does this teacher teach? She's going in for one session before the she's doing. So of course I, question and ask the teacher. She's like, no, I did not do that. That there's no way we do that in 45 minutes. But the rumor mill had started. And
right.
But it opened up a conversation for us to talk about, she had lots of questions about what is sex then. And one of her questions was, does it feel? And I told, people sometimes get uncomfortable about it. And so that's why you hear this stuff, and people may have older siblings. And then she was like, well, does it feel good? And I was like, yes, it feels good. But when you get older,
Yes.
But definitely was called to task, again, we've really worked hard on having those open conversations. And I talk to teenagers, like that's my comfort zone. It was just my own kid. I'm like, whoa,
right. It's
we had to do some
that
one.
So you got to think about what you want for your kids and what they want for themselves. And that's a conversation that I know that you're having, but a lot of parents are struggling with. Like, I want you to wait. I want you to think about it. I want you to have the right partner who cares about you, respects you, and all of these pieces.
Right.
And sometimes the words get stuck in our throat because we're so anxious around the conversation.
Yeah, exactly. Even talking about it now, I'm like, woo, a little heart palpitation. But as we make the connection to mental health and well-being, why is sex positivity connected to our mental health? Like, what are the things that, I'd love to hear your perspective. I mentioned, the sexual assault piece and the trauma that can happen when we don't have those conversations and people don't understand consent and, or if a violation does happen, how to talk about it. I know there's often a lot of secrecy, particularly if it's a friend or family member. So what are some other connections that you are seeing to mental health, or even to relate? This is all connected to relationships too. So share a little bit about what you're seeing as those topics intersect.
So I'll start with, for those of us who are mental health providers who follow the DSM or the ICD in particular, the DSM-5 has sexual functioning and sexual dysfunction as categories that we get to diagnose. So we absolutely need to know, because people are often coming in and there might be a sexual concomitant, like a sexual dysfunction that's concomitant with depression. Like you might experience, lower desire because you feel depressed, or you might feel depression because you have lower sexual desire than you once had. So we got sexual desire, orgasm, arousal disorders, pelvic pain, genital pelvic pain disorders. All of these are things that mental health professionals can diagnose. That's why we need to know and be very well educated on it. But then, to the point that you made about sexual violation and assault, the taboo that we have around talking about sex overall then trickles down into when something happens. Do people feel like they have trusted family members, peers, mental health professionals that they can talk about, where they will be validated and believed and affirmed and prepared to recover and heal? And if we are not even introducing the topic of sex, most people don't feel like they can introduce it themselves. And so in all of these systems, we want to be able to have open conversations about sex. And the other point about consent is really important here, because conversations around consent start really early on. Like when your kid is 1 or 2, and you go to your family member's house and they're like, hey, give me a hug. And your child doesn't want to give them a hug. Has nothing to do with sex, but they just don't want their bodily autonomy unconsensually like invaded. You got to give your kids permission to say, no, thank you. Or not right now. And not feel like you're disrespecting someone by saying you don't want to be touched by them. So even those conversations are then related later on sometimes, and even in those times, to sexual wellness.
Right. And I think a shift, because as we think about Black communities, hugging and giving high fives is such a part of our culture. And then I could see an auntie or grandparent being offended that the kids want to hug them, right?
Like, oh, you funny acting.
And so even I have shifted my practice, asking kids, even can I give you a high five? That is okay for me to give you a high five, right? Again, that communicate.
Ask.
Right. And that your body is yours. And even, I remember my son didn't like to be tickled by his auntie. And I'm like, and he talked to me about that. So we let her know, so just, in ways that we think that they're just kids and these are things that we like. And yeah, he might like it, but sometimes he may not. Right. And so that asking is such an important piece. So this has been so wonderful. So as we wind down, is there anything that you want to share that I haven't asked you yet? Anything you want to make sure our audience knows about this topic? I'm glad you already shared some resources for us that we could kind of do some more research, but anything else you want to share with us around this topic?
A lot of my work is on sexual wellness and liberation. And so you talk about, for me, good sex as a resistance strategy to all of the intersecting oppressions that strive to constrict Black people in particular to this really narrow idea of our sexuality. So we've got these sexual stereotypes about us, about being hypersexual. We've got sexual stereotypes about us as being inviolable, like people historically could just sexually assault and violate us with no recourse. And so as we think about that history in our current practices, when you engage in consensual sex or passionate sex or good sex that is healthy for you and for the people with whom you engage, that's resistance to all of that. And the foundational piece is to be able to define it for yourself. That's what liberation looks like. So sometimes people think when I say sexual liberation, I mean having sex with everybody indiscriminately. And, I think that that's such a hyperbolic way to think about it. Like sexual liberation for you could be abstinence. Sexual liberation for you could be sex work. But in anything in between, as long as you think about autonomously and critically engaging in those practices. So I always think about good sex as resistance and good sex as an opportunity for us to consider who we want to be, how we define our sexual selves.
Yes. So good sex is liberation and it's self-defined.
Yes.
You define it. And really, I even hear you saying, take space, because there's so many messages that we get from early on that's, parents, family members, TV, right? Sometimes it's hard to sift out what is it that you actually want.
Yes.
So making space to do that.
Absolutely.
Excellent. So any events you have coming up, any books coming up, anything that you want to share with us, and how can we stay in touch with you? How can people learn more about your work?
Absolutely. So I do have a book coming out, but it will not be out till February 2025. Just got my book contract. The book is going to be on good sex. So I'm really excited to share that. Y'all follow me at drcandicenicole.com or at dr.candicenicole on Instagram and YouTube and Facebook and Twitter. I'm usually on Instagram. I'll say that for sure. And YouTube. But those are the places where you can follow along this journey with me, like be in the community with me as I write this book. If you have questions about good sex or comments about it in the topics that I'm posting, feel free to share, because that's what gets to go into the book. I really want to think about good sex as liberation, and that's where the book will go. So I can't wait to share that.
I can't wait to read it. Well, good luck on all of your ventures. And I know we're continuing to partner with each other and really around this topic of good sex and sexual health. So you'll see her. This will not be the last time you see Dr. Hargons on our network, but thank you again for this time. I learned a lot here already. So I'm going to go work on my definition of what good sex is.
Yes, thank you.
Take care.